In today's GBMC RX Prescription for a Healthier You, we take a look at the challenge of healthcare access. Wayman Scott is the Associate Director of Diversity, Equity, Inclusion, and Community Relations for GBMC HealthCare. Welcome.
Thank you.
Happy to have you here. So tell us about the work that GBMC is doing in Baltimore City specifically.
We're increasing access to care. We have a primary care office, GBMC Health Partners, on East Baltimore Street. So it's right there in the neighborhood. It's easily accessible. And then for our older population that have struggles with mobility or chronic conditions that doesn't help them get out of the home, we have an in-home geriatric program where our doctors come to the house to provide primary care.
That is great. What would you say is the biggest barrier to seeking out health care? Is it that, or are there others?
Well, it's a twofold question. So number one, some people have difficulty with transportation. So you might need to go to the doctors, but you might not have a way to get there. So with our primary care center, we will send Lyft to your house to pick you up, get you to the doctor's office and back again.
Wow.
And then for older adults, if you have a chronic condition that doesn't allow you to get out the house, it's difficult to move, it's difficult to get around, that can be a barrier because people will miss their doctor's appointments at a time in their life when they need it the most.
Yes. And so GBMC identified that as a major issue and said, look, we can help, we can do this.
Absolutely.
Yeah.
So what we do by having this in-home primary care, in-home geriatric services, the doctor comes to the home. Our doctors and nurse practitioners have doctor's appointments at the living room table, at the kitchen table, at the dining room table. So we make healthcare easy. And then our primary care office, we set people up with appointments. They can do it online. We're often out in the community and we'll schedule an appointment right there on the spot.
That is great. Why do you think this work is so important? I mean, of course you want to help people, but also I think this has a broader effect for the entire community, right?
Yes, we believe in health equity. Everyone deserves to have the health care that they need, every neighborhood. And in our city, there are places like my neighborhood, who some might call a health desert, right? So by having a doctor's office right there, by having transportation built in, people get the help that they need. Everyone deserves to live long, healthy lives, and we're going to make that happen.
Which is so important for our community. Tell us about the community health workers that were able, or that you guys were able to hire this year through a special state grant.
Yes, the HERC grant made this possible. So the community health workers, they are everywhere. You're probably going to see them here and there, but they are in churches, they're at gyms, boxing gyms, retirement communities. They go to where the people are, they tell people about our program, how to access it, and how to access the resources like healthy food and transportation. And they enroll people there right on the spot, and they build trust.
Talk about that impact, because I'm sure you're hearing that from the community where it's like, wow, I didn't realize that I needed this, or wow, thank you for helping me get the health care that I need.
Yeah, oftentimes when we talk to people and they hear about our program and services, they're surprised that there's an organization, a healthcare system that will do whatever they can to help them. So we can send healthy produce to the home. We can also put them in a cooking class to show them how to make delicious food with that healthy produce.
And I know you hear stories all the time about how this has made an impact. I think one comes to mind for you, right?
Oh yes, there is a couple that lives in East Baltimore. They've been married for over 50 years. And the husband has been taking care of his wife who had advanced dementia. And it was to the point where he couldn't get her out to the doctors. She wasn't able to get the care that she needed. He found out about elder medical care. He enrolled. And now Dr. Charlene goes into the home, provides primary care. He can call our 24/7 line, talk to an RN anytime, and that makes a major impact.
Absolutely. I mean, just to know that you're not alone, and it's a lot for both of them. So to have that support with GBMC is really incredible. That's great. Thank you for sharing that, and thank you for being here today to give us all of this information. We appreciate it, and we'll be right back with more Midday Maryland right after this.